If we want to understand what microbiome is, if we want the field of microbiome to mature, we need to develop measurement instruments that have the precision and the resolution so we can find the things that are important. And we need to move away from current methods that give us overall picture and get to something which has the resolution to find the rare elements.
The most important thing is that we approach this with a sense of humility. This is an immensely complex field, and we know a tiny little bit of it. It's the beginning of a journey which is going to really change the way that we start seeing these problems that we're approaching. And as the capital markets that put the money into the development of these things push us to develop these into products that can be monetized, we as the experts must recognize the limitations of our knowledge.
Well, I think it's so important to not stay too long in preclinical models and doing in vitro and in vivo studies. The real proof of the pudding is really in going to the clinic. And we have the tools available now to make material that can be tested in clinical studies, and that will guide us the way forward.
We can move towards a fundamental understanding of the interaction of microbiome with the host by really diving down deep into what correlates from our microbiome to our clinical outcomes. What we need to do as part of our final push is establish what those correlates are to those clinical outcomes, and it will help us that much more in understanding not only what drives those clinical outcomes, but understand how those come about and then what we can do from there.
I think a lot of studies, much more than we're doing, could be done in humans. And if we did that, it would cost more money, it would take longer, it would require a bit more consideration of the parameters and how you do it, but it's essential that we do it. I mean, we have cured cancer in mice for years and years, and it hasn't translated to humans. So in my opinion, I think the governments that fund research should start to give us the resources to look at humans and the functionality.